Hello and welcome. Today we're diving into a common yet often overlooked condition, urethral stenosis, also known as urethral stricture. This is a narrowing of the urethra, the tube that carries urine from the bladder to the outside of the body. Understanding this condition, its causes, and its management is crucial for maintaining urinary health. Let's get started. So, what causes urethral stenosis? The etiology is varied, but the most frequent cause is injury to the urethra. This can occur from trauma, such as a straddle injury or pelvic fracture. Medical procedures like catheterization, cystoscopy, or prostate surgery can also less commonly lead to urethral damage and subsequent scarring. Infections, including sexually transmitted infections like gonorrhea and chlamydia, can contribute to inflammation and scar tissue formation. In rare instances, congenital conditions present at birth may result in urethral stenosis, and sometimes, the cause remains unknown, which we refer to as idiopathic urethral stenosis. Let's delve into the pathophysiology. When the urethra is injured or inflamed, the body's natural healing process kicks in. However, sometimes this healing leads to excessive scar tissue formation within the urethra. This scar tissue contracts over time, narrowing the urethral lumen. The restricted flow of urine from the bladder causes the bladder muscles to work harder to push urine through the narrowed passage. Over time, this increased pressure can damage the bladder and kidneys. Furthermore, the incomplete emptying of the bladder can increase the risk of urinary tract infections. Urethral stenosis affects people of all ages and genders, but it is much more common in men. Statistics vary, but studies suggest that urethral strictures affect a significant percentage of the male population at some point in their lives, especially with increasing age. This higher incidence in men is largely due to the longer and more complex anatomy of the male urethra. While women can also develop urethral stenosis, it's much less frequent due to their shorter urethra and a different spectrum of associated causes. The signs and symptoms of urethral stenosis can vary depending on the severity of the narrowing. Common symptoms include a weak or slow urine stream, straining to urinate, frequent urination, feeling like you can't completely empty your bladder, pain or burning during urination, and blood in the urine or semen. Some men may experience recurrent urinary tract infections. In severe cases, urethral stenosis can lead to urinary retention, a painful and potentially dangerous condition where the bladder is unable to empty at all. Diagnosing urethral stenosis typically involves a comprehensive evaluation by a urologist. The process usually begins with a medical history and physical examination. Urine tests are performed to rule out infection. Uroflowmetry, a non-invasive test, measures the rate and volume of urination, helping to assess the degree of obstruction. Further imaging techniques like cystourethroskopy, where a small camera is inserted into the urethra, allows direct visualization of the narrowing. Retrograde urethrogram, an X-ray using contrast dye, can also help define the location and extent of the stricture. Urethral stenosis can be classified based on several factors, including the location, length, and cause of the stricture. Location can be in the bulbar, penile, or membranous urethra. Length is described in centimeters or millimeters and can be short or long segment strictures. Cause, as previously discussed, includes traumatic, infectious, or idiopathic. This characterization is crucial because the type and characteristics of the stricture influence the best treatment approach. One common classification is based on the etiology of the stricture, such as post-infectious, traumatic, or iatrogenic. The treatment of urethral stenosis aims to relieve obstruction and restore normal urinary flow. Treatment options vary depending on the severity and location of the stricture. Initial management may involve dilation, where the urethra is gradually widened using dilators. Urethrotomy, where the stricture is cut open using a special instrument inserted through the urethra, is another common procedure. In more complex or recurrent cases, surgical reconstruction, such as urethroplasty, which involves removing the strictured segment and reconnecting the healthy ends of the urethra or grafting tissue to widen the urethra, may be necessary. The best approach is individualized based on the patient's specific circumstances. While it's not always possible to prevent urethral stenosis, there are measures you can take to reduce your risk. Practice safe sex to prevent sexually transmitted infections. Seek prompt medical attention for any urinary tract infections or suspected urethral injuries. When undergoing medical procedures involving the urethra, ensure that healthcare providers are experienced and follow proper techniques. Avoid unnecessary or prolonged catheterization. The prognosis for urethral stenosis varies depending on the severity and location of the stricture, as well as the chosen treatment method. Recurrence is possible, especially after less invasive procedures like dilation or urethrotomy. Urethroplasty generally has a higher long-term success rate. Recent research has focused on improving surgical techniques and developing new materials for urethroplasty to minimize complications and improve outcomes. Bioengineered urethral grafts are also being explored as a potential future treatment option. Regular follow-up with a urologist is essential to monitor for recurrence and manage any complications.
Thanks for watching!